project, TANDEM ABX, is really aimed at devising a novel pathway for introduction of a new last resort reserve antibiotic in low and middle income countries. As you know, there is a big challenge of antimicrobial usage and antimicrobial resistance in these countries. There is overuse, there is often irrational use, which in turn discourages innovator drug companies to introduce their drugs. So what we are trying to do is to see if we can couple stewardship practices at hospitals with access to such drugs so that the useful life of the drug is prolonged.
This is going to be a huge success story at the end of this whole project, because it would be laying a strong framework and also guiding future research. So it would provide a complete circle of introduction to uptake, monitoring, evaluation. I think it's going to be great just to highlight and showcase the fact that stewardship is important, strengthen it, strengthen capacity, strengthen health systems. It's not one person's business, as they say, it's everybody's business.
A project like TANDEM is extremely relevant because it actually is complementary to what we are thinking from a market perspective as well. This is very important to set in stage, and it's great that the preparedness is happening already to actually roll out something which will come in the next few years. Now we can see that all of them are collectively owning the problem in terms of actually antibiotic stewardship. Everybody's realizing the value of what it is to actually preserve a good antibiotic and what are the mechanisms by which, one, you preserve, but you also make sure that the patients who need it still get it. So it's a question of a balance of access and the excess.
In the state of Telangana, which is a part of the whole country, when we implement such a program, it could become a model to represent what the outcome could be. And based on that outcome, the learnings can be taken to the whole country. And also, I would suggest taken to the whole citizens of this world, especially the lower and middle income countries, where due to the lack of access, we have challenges in the way the right antibiotic not reaching the right patients.
One very unique aspect of this particular conference is it is multidisciplinary, where we had stakeholders across various organizations ranging from the healthcare systems to the pharmaceutical companies, to the government, and also to the private sector, which includes the biotech, diagnostics, and also the tech companies.
So every antibiotic that comes out into the community is a precious commodity, and we can prolong its shelf life if you're able to use it in the right place for the right indication, and only if required. Not only it helps prolong the shelf life of that antibiotic, it can help this solidify or improve the AMSP program in the state. It teaches the state how to introduce AMSP programs as a network, in a network of hospitals, both in the government and the private sector. So it is not just going to help you in this particular project, but it's capacity building in overall for the state.
India is a federal structure, and health and also education are the topics which are to be dealt by the states. So in this context, it is very, very important that states are going to adopt and implement the local action plans, which we also call it as sub-national action plans or the state action plans.
So if we are prepared for any new antibiotic which could be around the corner for addressing such infections due to MDR or XDR pathogens, then it will be very useful in many ways. One thing is that it will ensure that these drugs are not misused, and that will increase the longevity of the drug, improve the patient outcomes, and also retard resistance as far as possible.
This project will help us in prepare ahead of introduction of the drug in the market and in the introduction of the drug for use before we can make the systems in place so that we can use it very judiciously and rational use of drugs can be provided.
We should incorporate the technology in the overall the system so that we can track where from the drugs are coming, who is sourcing the drugs, how hospitals are utilizing it.
Kerala, I think, is making major strides already in the area of antibiotic stewardship, and I think the discussions today brings about a bit more of clarity and maybe I should say a positive feedback on the efforts that are already happening. It gives us an opportunity to introspect with the experience from other parts of India as well as other parts of the world.
I think it's a very good initiative from the ICARS, which is basically brought up the various stakeholders today in terms of government representatives from the Kerala government, health secretaries, infectious disease doctors from the public care hospitals of the state, doctors from the private care facilities of the state also.
So it is something which can be translated into action on the ground. Plus, it is a system-wide approach rather than in pockets of excellence or where a certain amount of infra is present and it can only be adhered or implemented there.
So ICARS has been working with low and middle income countries to provide solutions for appropriate use of antibiotics that strengthen antimicrobial stewardship. But the aim has been not to do piecemeal strengthening of stewardship for specific diseases or class of patients, but overall to introduce a framework that can have access and stewardship working together that creates a pathway for sustainable, appropriate use. ICARS works on intervention implementation research, and ISB's aim of operational efficiency is something which we hope can be a win-win partnership for us together with the CMC Vellore in the south.